clearance and hyperinflation.
So this is just one of the devices, but all of them are going to be kind of similar. It usually has a mouthpiece. It'll have a piece of tubing in it. Will connect to some kind of pressure source. This inside, there's a little blue column that will go up, and around here is this little gadget. There are different size openings. I'm going to pass it around, and there's an arrow. When the arrow aligns, it's kind of a clear stamp to one of the numbers. It indicates the size of the opening. So the bigger the number, the bigger the opening. And what we're doing is we're having the patient breathe in, and as they're breathing out, it adds that back pressure. So it pushes open the lungs, and it adds some resistance. So remember, when we're doing our pursed lip breathing, we kind of are putting some pressure back on the lungs to keep them inflated, to get more air out. This helps mobilize some of the secretions in that same way, right? So, and you can even put a breathing treatment sometimes in between. You can put your neb in here, put this in here, so you could do an SVN treatment while you're also doing PEP therapy. Typically, you would want to be monitoring your vital signs, because this could increase heart rate and cause desaturations. But you would just do your treatment. I would say do about 10 breaths, and then have the patient take a rest for a minute, and then do 10 more breaths. And you can always follow it up with that huff coughing. Do you guys remember how we do that? So this Arabica acapella, they add a little bit of back pressure. Do you guys remember those as well? Yes. But this one is where you can actually physically measure the pressure that you're generating, whereas the other ones are just kind of a random. It's more airway clearance, but it does add some back pressure to it.
And isn't it the higher the number, the more the positive pressure, more resistance, right?
On this? Well, yeah, it would be the smaller the number, the more the smaller the number, the higher the back pressure, because we've gone from breathing through a hole that's this big to breathing through a hole that's tiny. And the way that you can check it is if you were to take off the gadget, and if you look through on this side, okay, so we're looking down the barrel, and you turn it, you'll actually see when the arrow aligns to a different number. Number 1 is like a sliver, whereas number 6 is a significant hole. So the smaller the opening, the more back pressure that we're applying to the airways to help keep those lungs inflated. Does that make sense?
So the goal would be that the patient would start at the higher number and eventually work down, so that they're getting more resistance training over time. So very, very popular in COPD patients, especially when you take your tests. They want to know what can be done to help with secretions. And it's very ambulatory. You can take it with you, and PEP therapy is the answer.
What is it called?
PEP?
This one?
Is there a brand name for that, Sharon?
No, it's just PEP.
It's just PEP therapy. There's some people call it Easy PEP, but on the test it's going to be called PEP therapy.
Easy PEP? Oh my gosh.
So then these are the other things. This also adds more of a vibratory phase to it as well. Do you guys remember? So it kind of makes sense.
Isn't that what sets in the hospital more?
Both of these. This one, yeah, this is a little bit older.
The
But you never know, you might
see a lot.
still see it.
You want this one, the green one?
And like I said, there's usually a gadget that looks similar to that one, but it's just almost a T-piece that kind of has a pink color to it that will connect to a manometer, a pressure gauge.
So the overall category is called PEP therapy, but there's Easy PEP, there's other brand names for them, but we're talking about all different forms of PEP therapy. So a lot of people don't think just plain old positive pressure is going to help with secretions, but what it does is it helps get the airflow behind the secretions, and once you can get that positive pressure behind the secretions, then it can allow the patient to cough it out. So it's very effective. Okay?
It's airflow behind the secretion.
Yeah.
I'll see if there's a second one actually.
Okay. Okay, so once you're done writing